stage 1, the first year and the second year. If you have any questions in your GoToWebinar, just type it in there. I'll try to check it throughout. If not, I'll get to them at the end. Again, the webinar is on meaningful use, attestation for stage 1. My name is Anuja. I'm an application specialist here. So if you have any questions, again, just put them in the chat box. Today, what you will get out of this webinar is how to decide whether your reporting period is for the first year or the second year. You'll find out which reports need to be submitted, how to review your meaningful use reports. You'll learn about how to enter missing data and to achieve that goal successfully. We'll also talk about the difference between stage 1 first year submission and stage 1 second year submission. And finally, we will talk about how to attest your data. Okay. The first thing, again, we'll talk about is how to decide whether your reporting period is for the first year or second year. If you are in your first year of Medicare, you will be submitting a full 90 days. You want to submit your best 90 days. If you are in your second year of your Medicare incentive program, you want to report the full year. So the full year is considered January 1st to December 31st. So for example, if you submitted data in 2011 for your 90-day submission, you wouldn't have to submit data until 2013 because you would be submitting the full year from 2012, so January 1st, 2012 to December 31st, 2012. Please keep in mind the deadline for submission for this year for your 90-day and 1 year for your Medicare incentive program is February 28th of this year, 2013. Now we'll talk about all the reports that need to be submitted. Just a brief overview, you have to submit 15 core set reports. Each of those 15 core set reports have goals that you have to meet. The next group is called your menu set reports. You'll be submitting 5 out of 10. The third group are your CQMs, stands for clinical quality measures. You have 3 of those that you need to submit. However, if you can't meet the core reports, they have alternate reports that you can work on. And the last section is your clinical quality measure additional reports, and you have to select 3 out of 38. So the first 15 core set reports are here. The first one is percent of patients for whom medication orders are entered by physicians through CPOE. CPOE is computerized program order entry. So when you're in the current medication section or the RX section in the visit note, there's a entered by. You want to make sure that's the physician's name. The second one is implement drug, and drug allergy checks. This is automatically done by us. It's most likely enabled. You can always check to see if it's enabled by going to Tools, Preferences, User Preferences, and when that screen opens, there'll be a tab on top that says Prescriptions. If you click on the prescriptions, it'll tell you which level of alerts you are at for both of them, the drug, and the drug allergy. Third one is percent of permissible prescriptions transmitted electronically. This is just e-prescribing. The fourth one is percent of patients whose demographics is recorded as structured data. The 5 things you want to make sure that you're recording are gender, date of birth, ethnicity, race, and preferred language. And on the demographics page, they will all be in red font, so you know you have to fill those out for meaningful use. The fifth one is patients with an up-to-date problem list. Number 6 is patients with an active medication list. 7 is patients with an active medication allergy list. So keep in mind that 5, 6, and 7, those happen to be the highest goals here. They're all at 80%. So you'll have to work pretty hard to make sure that you're achieving that goal. Number 8 is patients whose vitals are recorded as structured data. Vitals include blood pressure. There's 3 of them that are in the vital section. You're only required to document one of those: height and weight and BMI. And keep in mind that when you put the height and the weight in, the BMI will automatically populate when you click somewhere else. 9 is percent of patients 13 years or older whose smoking status is recorded. This can be done when you're in the visit note, you're under PFSH. Then you want to click on social history, and towards the bottom you'll see a cigarette icon. You want to click on that, a little smaller icon will appear, and you want to select one of those 6 options that appear. 10 is implementing one clinical decision support. We have clinical alerts that are based in the system. This one just requires that you use at least one throughout the reporting period. 11 is reporting ambulatory clinical quality measures to CMS. There's nothing different you have to do here. This is just a yes or no question. The answer will be yes because you have to submit your CQMs. 12 is percent of patients provided with an electronic copy of their health information upon request. So if none of your patients request an electronic copy of their health information, you can file an exclusion. 13 is percent of encounters for which clinical summaries were provided. Again, within the visit note, towards the bottom, there'll be a visit summary section. You want to click on that, and on top, there's a checkbox that states, I have given the following instructions to the patient. You want to make sure that you're clicking on that because the goal here is 50%. Next one is capability to exchange key clinical information. And the last one, number 15, is protect electronic health information created or maintained by the certified EHR technology. Again, these are just the first 15 labeled the core set reports. The next set of measures that you have to submit are your menu set measures. Here you have to submit 5 out of 10. One of those 5 either has to be 1 or 2. 1 refers to an immunization registry, and 2 refers to submitting electronic syndromic surveillance data to public health agencies. The other menu set measures you have are implement, number 3, implement drug formulary checks. 4% of clinical lab results incorporated into the EHR structured data. 5, generate at least 1 report listing patients of the EP. EP stands for the physician with a specific condition. 6 is percent of patients sent reminders for preventative follow-up care. For this one, it only applies if the patient is under the age of 5 years old or over the age of 65. 7 is percent of all patients with timely electronic access to their health information. This one refers to the patient portal and actually giving them access to it. 8 is percent of patients who have been provided patient-specific educational resources. Again, when you're in the visit note, there's a patient education tab. You want to select that and be able to provide some sort of education for the patient, and you just want to check it off and make sure that at the bottom that it says, I have given the following patient education resource. You want to make sure that's also checked off. 9 is percent of transitions in care where medical reconciliation was performed. And 10 is percent of transitions in care for which summary care record is shared. The next group that you will have to submit are your CQMs. Again, CQMs are clinical quality measures. The 3 that you have to submit are blood pressure management, tobacco use assessment, and cessation intervention. And the last one is adult weight screening and follow-up. However, if you don't think that your practice can meet these 3, they give you an alternate group that you can submit, which are weight assessment and counseling for children and adolescents, childhood immunization status, and influenza immunization for patients 50 years or older. The last set that you have to submit are your additional reports, your clinical quality additional reports. There are 38 of them. This goes over into the next slide. You have to pick any 3 of these. I won't go through every single one. I'll just leave it on this slide for a minute or so you can read through them. All of these are available in our system. Okay, so these are the first 19. I'm just going to move on from 20 to 38 here. Okay, I'm going to move on. Unless you want me to stay on this page, you can put something in the notes. The next thing we'll talk about is how to review your meaningful use reports. The first thing you want to do is exempt all the test patients that are in your system from reporting. We'll talk about setting your reporting period, how to select the provider, how to generate the latest report, and how to export that data into an Excel spreadsheet. So the first thing you want to do is exempting your test patients from reporting. So you want to open up your patient selection screen. You want to type in tests, and all the test patients that show up in your patient selection screen, you want to manually go into every single one of them and click on that Modify button towards the bottom. And when you click on the Modify button towards the bottom, you'll see the demographics open. Here on the left-hand side, towards the middle, you see this exempt from reporting. You want to check this checkbox off for every test patient in the system, and then you want to click on OK to save that. Now we'll talk about actually how to review your MU dashboard. To get to your MU dashboard, you want to use this last circular tab on top. It looks like a graph. You want to click on that, and that'll open up the MU dashboard. The first thing you want to do is select your reporting period. So again, if you're in your first stage, you want to select 90 days. If you're in your second stage, you want to select the full year. Next, you want to select the provider using the drop-down. And then you want to click on the Show button on the right-hand side. Sometimes it'll take a few minutes to load all that data because it's extracting it from such a long period of time. Once that little circle is gone, you know that you have the latest data according to that date range. On the MU dashboard, you'll see the goal, the numerator, the denominator, the exclusion, and the percentage. Someone wanted me to repeat the last slide, so I am just going to go back one more here. You want to select the provider, so the provider section is here in this red outline. You want to use a drop-down. All the providers in your practice will appear. You just want to make sure that you're selecting the proper one. And then you want to click on this Show button here towards the right-hand side. And once you click on the Show button, it will extract the latest data according to that date range. Now you can export this data into an Excel spreadsheet. You want to click on that Export button. When you click on the Export button, it'll ask you to open it or save it. And once you click on Open or Save, it'll successfully export the data into your Excel file. Okay, so the next thing we'll talk about is how to enter missing data and achieve the goal successfully. There's 2 ways to do this. The first way to extract the missing data is through the enterprise quality reporting, and the second way is through the meaningful use dashboard using the graphical view form. So when a percentage is in red and you want to improve it, you want to click on Reports. You want to click on Enterprise Quality Reporting, and this screen will appear. You want to select the provider. You then want to select the date range. Under program code, you want to select meaningful use. Under group, you want to select the first one, which is percent-based measure for MU objectives. And lastly, you want to select the report in which you want to successfully achieve, where that data is missing. Once all this top half information is filled out, you want to click on Detail. And when you click on Detail, another screen will appear looking like this. The ones in orange are the ones that need improvement. As you see, the numerator is missing here. You just also want to make sure the denominator has a Y next to it, meaning that something has been entered. The numerator is what you want to focus on, where it's missing here. You can also export this to Excel if you had more, if you had like 15 pages here. You want to click on the preview button at the bottom. You want to select Excel here on the top right-hand corner and click on Export. When you export it into the Excel file, you'll be able to filter it so then you can only see the numerator where there are blanks and focus on those. So that's why we recommend doing this. When you export it, you'll be asked whether you want to open it or save it. You want to save it. You want to highlight this section here and then put a filter on it. Under the D1, which is denominator, you want to select Y. Under the numerator here, you want to select blanks. And this will show you the patient's names where the information is missing. And now you can go into these 4 charts and enter that data. The second way to obtain those names is through the MU dashboard itself. Here on top you have tabular and graphical. You want to select the graphical. Again, you want to make sure your parameters are set, so you want to select the correct provider and the proper date range. You want to, again, click on the Show button, let it load. And the one that you actually want to improve, you will click on the pie chart itself. And when you click on the pie chart, it'll open up that particular measure. And now you want to click anywhere within the graph. So anywhere within this red outline here, you want to be able to click on it. And those same names will appear here. These all have the D1 as Y. The numerator, the ones that don't have anything, are the ones, again, that you want to work on. I just wanted to reiterate the difference between Stage 1 first-year submission and Stage 1 second-year submission. Again, please keep in mind the Stage 1 first-year submission is 90 days, and Stage 1 second-year submission is the full year. So the example I gave earlier, if you submitted 90 days in 2011, the next time you would submit data is not actually until early 2013, because you would be reporting January 1st, 2012 to December 31st, 2012. And again, your deadline for this year is February 28th for your 90-day submission and 1-year submission. Now we'll talk about how to submit the data, your attestation part. When you log into the website, you'll see the welcome screen, welcome to Medicare and Medicaid EHR Incentive Program Registration and Attestation System. If you don't have a login, if you don't have the website is here on the PowerPoint. You want to click on the Continue button. Again, you want to click on the Continue button to proceed. Now you want to read these 6 statements. If you agree to them, you want to click on that checkbox at the bottom that says check this box to indicate you acknowledge that you are aware of the above statements. And then click on the Continue. And this will take you to the login page. You want to use your user ID and password, and then click on Login. And now if you are ready to attest and submit your data, once everything is in green, once you've checked everything, you want to click on the attestation section. And now towards the bottom you'll see the provider's name, their last 4 digits of the tax ID or their Social Security, and their NPI. And if you're ready to go ahead and attest, you want to select the attest. You pretty much work your way from numbers 1 down through 6. So you want to click on 1, which is Attestation Information. The attestation information, you'll be asked to put in the EHR certification number, your reporting period, and once you put that in, it'll take you directly into the meaningful use core measures where you'll start submitting your data. For example, this is number 1. It's the CPOE for medication orders. It'll ask if this exclusion applies to you. You hit yes or no. If you click on no, it'll expand this to the second half of the screen, and you'll be asked to put in your numerator and denominator. And this is pretty much how all of the other measures will be submitted. They'll go one by one, and you'll be asked if this exclusion applies to you, and then to manually enter the numerator and denominator. You can use this website for a step-by-step guide of the attestation. And lastly, if you have any questions, you can type them into the GoToWebinar. You can call our support at 877-863-3328, or you can email us at implementation@ipatientcare.com or support@ipatientcare.com. So I'm just going to go through some questions. So one of the questions was, we chose a 90-day ending in July 12, 2012. What should be our attestation period for 2013? So for 2013, you'll submit from January 1st, 2013 to December 31st, 2013. And that means you actually won't be submitting again until early 2014. It says, will you be providing us with a copy of your PowerPoint? Yes, we could do that. One of the next questions was, the practice has to be on EMR Live before any of this can be done, correct? Correct. So that means the physician needs to be live using the system on all of their patients within that reporting period. Again, for Medicaid, there were a few questions on Medicaid. We mostly focus on Medicare today. So for Medicaid, it's a little different. There's actually 3 parts to it. Medicaid, the first year is your AIU, which stands for Adapt, Implement, and Upgrade, and that's all that's required your first year. Your second year is submitting 90 days worth of data, and your third year is submitting the full 1 year, so January 1st to December 31st. So that was one of the other questions. The next question was, how do we get credit for labs? For labs, it has to be entered as discrete data. So if you order a lab and you receive it via mail, you want to manually enter the CBC, and by manually I mean entering, white blood cells, red blood cells, neutrophils, and putting in the actual number. There's another way to do it that's a little easier, is setting up an interface. We can do Quest or LabCorp. We can try to do a local lab that you're using. You just want to have your representative for Quest or LabCorp or any other lab email Shahab, S-H-A-H-A-B, at iPatientCare.com, and between them they'll start working on figuring out how to go about the interface. One of the other questions was they can't see Stage 2 on the MU dashboard. Stage 2 is actually not even required until 2014, so we haven't put it in the system yet. Once we're closer to the date, we'll have Stage 2 criteria set up in the system. But again, it's only January, so we probably won't do that until later in the year. The labs are already interfaced but are not showing on the reports. You might not properly be attaching them correctly. If you need further assistance on the lab interface, you can again email Shahab, or there's another email that you can use, interfaces at iPatientCare.com, and they can help you a little further and figure out why your numerator is not calculating properly. One of the other questions was, in CPOE, if MA enters any RX, can she put her electronic signature in to achieve meaningful use? So for the measure states the physician has to do it. CPOE is the computerized order physician entry, so it would have to be done by the physician. And thank you for joining and spending the hour with me. Are there any more questions that you might have? Please put them in the question section of the webinar. Okay, it seems like there's no more questions here. Again, if you have any further questions that you might think of later, call support at 877-863-3328 or email implementation@iPatientCare.com or support@iPatientCare.com. You can obtain a copy of this video along with the PowerPoints on our support portal. If there are no more questions, we'll conclude today's session. And thank you for joining and spending the hour with me.